I think a good provider, a good physician, the main ingredient is to be, so to speak, a competent translator. You need to have good clinical, technical knowledge with a wide variety of problems that you're going to take care of. And that's half of it. The other half is that you have to be able to communicate that with the patient, have the patient trust you, have the patient, buy into what you're going to be recommending so that, they have the best outcome they can. My inspiration to pursue medicine came from first starting work in research and biomedical research in college. And so the idea of going to medical school kind of came to me at that point during college. The patient kind of segment that I really identified with was the head and neck cancer patient, because they have specific challenges, they have kind of specific issues that they'll deal with, and stewarding the patient through each step of that process and recovery and surveillance and survivorship. That really was the essence of what drew me to head and neck. The specialty of head and neck cancer kind of has two branches. The first branch of head and neck surgery is the oncologic side, where you're actually removing the tumor, removing tissues from the patient in order to get them to be cancer-free. The second branch of the specialty is the reconstructive side of it. A lot of our, the cancers in the oral cavity or in the throat, they can affect the patient's ability to breathe, to swallow, and to speak. Once they're recovered, once they have been reconstructed, once they've had a chance, their bodies have had a chance to heal after treatment, those functions oftentimes can start to recover. And that recovery, where the patient is functioning the way that they did before their cancer, that's really the most rewarding thing. There are a great deal of technological advancements within head and neck surgery that function specifically to make the surgeries and the procedures less invasive. So a lot of our procedures can be done open, but we have, as a specialty, pioneered using the robot for minimally invasive throat surgery. We have sinus scopes, which allow us to take care of cancers in the nasal sinuses and in the base of the skull. So there's actually a lot of tools to be able to adequately do minimally invasive procedures with very good outcomes. And then we obviously have the training and the preparation to do a larger open surgery when it's actually required. Those first couple of interactions that you have when you walk in with the patient, you get a sense of where their anxiety is, what they're concerned about, what are the issues that they're focused on. And I think it's important to basically address those things right from the start so that they feel like their questions were answered, and then they can listen to what we're going to say and what the next steps are going to be, and then they're much more open and receptive to that. Everybody's story is an evolution, and it's my job to kind of make sure that that evolution is going in the correct way.